to demonstrate the steps for self-care uterine massage. And you want to start with something slippery like oil. I'm going to use tallow body butter. And you're going to use 2 hands. So you can do this laying in on your bed or a yoga mat or anywhere that's comfortable. But the technique is to help lift the uterus and put it into proper position. Uterine prolapse or displaced uterus can be the cause of many uncomfortable female reproductive complaints. And this is a technique that you can go to a practitioner for, but it's very easy to do on yourself. So I've got my tallow body butter. The first step is you want to actually come to the top of the pubic bone. So you're going to use your fingers like a rake. And you're going to find the very top of the pubic bone and press just into it. And make a rake with your fingers and tuck your thumbs in and pull all the way up to the belly button. You want firm but gentle pressure. And repeat that motion. And this is just a gentle lifting. I learned this tradition from a Mayan indigenous healer where this was an everyday practice in her culture. She said that women in her village would massage their uterus every night before bed. It was as natural to them as brushing their teeth. And as a result, they had very good female reproductive health. She said that the women, the uterus determined the health of the entire village, and it was very important to hold proper position of the womb. So this motion, I repeat it about 10 times, just moving up, firm but gentle pressure, using your fingers like a rake. And then the uterus can also flop side to side. So it can go forward, it can go backward, it can go side to side. So we want to adjust for all sides. So that's the center. And now we're going to come to the hip bones. So if you have large-bodied women, you might not feel the hip bones jutting out, but you can just kind of feel where the bone would be and come in on the inside of the bone and again pull all the way to the belly button. And you'll usually repeat this about the same number of times. If a woman is known to have a tilted uterus, say the uterus is tilted more this way and that's known, you'll actually pull more times on this side. So you might do like 10 times on this side, and then you would only do 5 times on the other side if it's out of place. But normally you would do them even if you're unaware. You would do like 10 pulls this way, 10 pulls this way, and then come to this side and 10 pulls towards the belly button all the way up to center. And sometimes you can feel where the uterus lives. It's about the size of your fist, located 2 inches below the navel. And you don't have to necessarily feel where it is. There are other things in there, like your intestines. But you are actually moving things. So this is a self-care massage technique any woman can do. It's a wonderful healthcare routine. It's not painful, and it can actually help a lot of back pain and other symptoms that can result from displacement.